Why do we ask rabbis medical advice if they're not doctors? Well, we don't look to rabbis for medical advice. We look to rabbis when faced with a medical decision to bring a few things to the table. Their expert knowledge of Jewish law, number one. Number two, hopefully their own level of proficiency with medical procedures, which is why in rabbinics, just as in medicine, there are subspecialties. And when we're faced with a decision concerning medicine, we would look for a doctor with a strong background in those particular issues. And finally, and perhaps most importantly, we're looking for the objectivity that a rabbi might bring, as a person is by definition unable to be objective about themselves and their life's circumstances. As Rabbi Irving Breitowitz points out in his excellent writings on the subject, there are times when subjective information becomes objectively important to the decision at hand. So the rabbi's job is to pull the various strands together: the subjective information about this individual's life, their mental health, their support system and such, along with the medical data, and finally to adjudicate this all from within the prism of a halachic rubric. So, for instance, in the beginning of life issues, like in dealing with an abortion, or in end-of-life issues, such as in dealing with when to withdraw certain treatments, all of the above requires the medical profile of this particular patient, understanding the personal life, the inner landscape, and what surrounds them, and the halachic axioms about the infinite value of each increment of life versus the value of mitigating pain in the end-of-life scenario, or being attentive to mental health, say when discussing an abortion. So all of this and more would have to come into play in order to arrive at a proper decision.